Good morning, Miss Campbell. I'm Dr. Smith.
Hi. Please call me Karen.
I'm Ian, Karen's husband.
Hi, I'm Sue, your mom's nurse. Hi. Good to meet you.
Ian.
Karen, I'd like to talk with you about your mother's condition and about some decisions that may need to be made.
Okay.
Can you please tell me what you understand about her condition right now?
Well, I know that she had a heart attack and her heart isn't functioning well right now, and that she needs a breathing machine to help her get enough oxygen to keep her alive.
Yes, that's correct. I think it's possible she'll get worse. So if that's the case, her heart may totally fail. If that happens, we may have to do CPR to try to keep her alive.
I had some questions about that. I was looking on the internet and found a website called My ICU Guide. It had information about treatments in the ICU and a video which explained everything about CPR. There was also some questions that we answered which helped us to think about what would be best for our mom.
I'm not familiar with this website. Are you sure that the information is correct? I mean, the internet, it's not always the best place to find information.
Well, it says the site was created by a critical care doctor. Here's the report that we got when we filled out the questionnaire. I think it might help you to understand what's important to our mom so that we can talk about possible treatments for her.
Okay, let me take a moment to go through this. These are your answers to the questions, or are these your mom's?
They're mine. But I answered them how I think Mom would have answered. When she asked me to be the person in charge of her medical decisions if she wasn't able, we talked a long time about what she would want if she became sick.
Okay, you note here that your mom would find being confined to a bed or not being able to look after her personal care as being unacceptable. You've also said that she would want treatments to focus on the quality of her life rather than prolonging her life.
Yes. My mom's 83 years old and she's quite frail, and up until now she's enjoyed a good quality of life with friends and family. She is very worried about losing her independence. You know, my dad died 20 years ago and she's been alone. She's not afraid of dying. She's more afraid of living and not being able to take care of herself.
It sounds like having her independence is important to her.
Yes, very much so.
Okay. Your mom is stable at the moment, but her organs are showing signs of injury. And I'm worried that if her organs continue to deteriorate, she may not survive her illness. Now, if she does survive, she may have a poor quality of life and not have the independence that's important to her.
At this point, I know she wouldn't want life support, especially if you can't guarantee she'll survive and be back to the way that she was.
I can't provide an absolute guarantee. Now, if your mom does survive, it's unlikely she'll be able to look after herself in light of all the medical issues she has now.
I know she wouldn't want this. What are we going to do?
Perhaps the best course of action then is to consider stopping the life-sustaining treatments that we're providing her and focus just on keeping her comfortable and allow nature to take its course. If we did that, it's likely she would die within hours.
I think this is what she would want.
Okay. We want to respect her wishes. Thank you for showing me this information. I found it very useful in helping me understand more about your mother and about her values and wishes. We want to make sure we provide the medical care that's right for her.
Thanks, Doc. We really appreciate your time.